Vitamin D3 deficiency occurs when there is an inadequate level of vitamin D3 in the body. It can result from various factors, including insufficient sunlight exposure, limited dietary intake, impaired absorption, or certain medical conditions. Here are the causes and symptoms associated with vitamin D3 deficiency. Inadequate sunlight exposure. The primary source of vitamin D3 is sunlight. People who live in regions with limited sunlight, spend most of their time indoors, or consistently cover their skin when outside may be at risk of vitamin D3 deficiency. Lack of dietary intake. Vitamin D3 is found naturally in certain foods such as fatty fish, salmon, mackerel, cod liver oil, egg yolks, and fortified dairy products. Individuals with limited intake of these vitamin D-rich foods may be at higher risk. Limited absorption. Some medical conditions, like celiac disease, Crohn's disease, and cystic fibrosis, can impair the absorption of dietary vitamin D3 in the intestines, leading to deficiency. Darker skin pigmentation. Melanin, the pigment responsible for skin color, reduces the skin's ability to produce vitamin D3 in response to sunlight. People with darker skin pigmentation, particularly those with high melanin levels, may require more sun exposure to produce sufficient vitamin D3. Age. Older adults have a reduced capacity to produce vitamin D3 in their skin and may have limited dietary intake, putting them at increased risk of deficiency. Obesity. Vitamin D3 is fat-soluble, and excess body fat can sequester vitamin D3, making it less available for use in the body. Obesity is associated with lower levels of circulating vitamin D3. Symptoms of vitamin D3 deficiency. Bone and muscle weakness. Vitamin D3 deficiency can lead to weakened bones and muscles. In children, it can cause rickets, characterized by bowing of the legs, delayed growth, and softening of the bones. In adults, it can contribute to osteomalacia, which results in bone pain, muscle weakness, and an increased risk of fractures. Fatigue and weakness. Low levels of vitamin D3 may cause fatigue, generalized weakness, and reduced energy levels. Mood changes. Some studies suggest a link between vitamin D3 deficiency and mood disorders like depression. Symptoms may include feelings of sadness, low mood, and lack of motivation. Impaired wound healing. Vitamin D3 plays a role in the healing process, and its deficiency may impair wound healing. Increased susceptibility to infections. Vitamin D3 deficiency can compromise immune function, making individuals more susceptible to infections and respiratory illnesses. Bone and joint pain. Deficiency of vitamin D3 may manifest as bone and joint pain, particularly in the lower back, hips, and wrists. It's important to note that these symptoms can be caused by various other conditions as well, so it's essential to consult with a healthcare professional for proper diagnosis and treatment. A blood test can measure your vitamin D levels and help determine if you have a deficiency. If diagnosed with a deficiency, your healthcare provider can recommend appropriate treatment options, such as vitamin D3 supplementation or increased sunlight exposure, depending on the severity of the deficiency.